In this video, we are going to talk about lipids and cardiovascular disease. Cardiovascular disease is the major killer of North Americans. It typically involves the coronary arteries, and thus frequently the term coronary heart disease (CHD) or coronary artery disease (CAD) is used. Each year, about 600,000 people die of coronary heart disease in the United States. About 715,000 people in the United States have a heart attack each year. Women generally lag about 10 years behind men in developing the disease. Still, it eventually kills more women than any other disease. The cost of coronary heart disease alone is $108.9 billion each year, which includes the cost of health care services, medications, and lost productivity. Development of cardiovascular disease. The symptoms of cardiovascular disease develop over many years and often do not become obvious until old age. Nonetheless, autopsies of young adults under 20 years of age have shown that many of them had atherosclerotic plaques in their arteries. This finding indicates that plaque buildup can begin in childhood and continue throughout life, although it usually goes undetected for some time. The typical form of cardiovascular disease, coronary heart disease, and strokes are associated with inadequate blood circulation in the heart and brain related to buildup of this plaque. Blood supplies the heart muscle, brain, and other body organs with oxygen and nutrients. When blood flow via the coronary arteries surrounding the heart is interrupted, the heart muscle can be damaged. A heart attack or myocardial infarction may result. This may cause the heart to beat irregularly or to stop. About 25% of people do not survive their first heart attack. If blood flow to parts of the brain is interrupted long enough, part of the brain dies, causing a cerebral vascular accident or stroke. A heart attack can strike with the sudden force of a sledgehammer, with pain radiating up the neck or down the arm. It can sneak up at night, masquerading as indigestion, with slight pain or pressure in the chest. Crushing chest pain is a more common symptom in men. Many times, the symptoms are so subtle in women that death occurs before she or the health professional realizes that a heart attack is taking place. If there is any suspicion at all that a heart attack is taking place, the person should first call 911 and then chew an aspirin thoroughly. Continuous formation and breakdown of blood clots in the blood vessels is a normal process. However, in areas where plaques build up, blood clots are more likely to remain intact and then lead to a blockage, cutting off or diminishing the supply of blood to the heart or brain. More than 95% of heart attacks are caused by total blockage of the coronary arteries due to a blood clot forming in an area of the artery already partially blocked by plaque. Disruption of the plaque may even lead to eventual clot formation. Atherosclerosis probably first develops to repair damage in the vessel lining. Ongoing inflammation in the blood vessel is suspected of causing blood vessel damage. The damage that starts this process can also be caused by smoking, diabetes, hypertension, viral and bacterial infection, and LDL. In addition to causing damage to arteries, LDL then enters the damaged areas of the artery walls and begins to accumulate. Atherosclerosis can be seen in arteries throughout the body. The damage develops especially at points where an artery branches into two smaller vessels. A great deal of stress is placed on the vessel walls at these points due to changes in blood flow. Once blood vessel damage has occurred, the next step in the development of atherosclerosis is the progression phase. This step is characterized by deposition of plaque at the site of initial damage. The rate of plaque buildup during the progression phase is directly related to the amount of LDL in the blood. The form of LDL that contributes to atherosclerosis has been changed by free radicals into oxidized LDL. The oxidized LDL is preferentially taken up by scavenger cells in the arterial wall. Nutrients and phytochemicals that have antioxidant properties may reduce LDL oxidation. Fruits and vegetables are particularly rich in these compounds. Eating fruits and vegetables regularly is one positive step we can make to reduce plaque buildup and slow the progression of cardiovascular disease. Some fruits and vegetables are particularly helpful in this regard includes legumes, nuts, dried plums, raisins, berries, plums, apples, cherries, oranges, grapes, spinach, broccoli, red bell peppers, and onions. Tea, coffee, and dark chocolates are also sources of antioxidants. The body also sends white blood cells called macrophages to the location of the cholesterol accumulation on the blood vessel wall. In an attempt to destroy it, the macrophage surrounds the fatty deposit and produces lipid-loaded foam cells. Over years, as cholesterol plaques form and grow inside arteries, they eventually can begin to block off blood flow. The LDL-rich center of the plaque grows in a slow, controlled way and seldom causes heart attack, but arteries harden, fragile, and lose their elasticity. Affected arteries become further damaged as blood pumps through them and pressure increases. Some plaques can become unstable and tear away from the artery. If they rupture, a blood clot will form inside the artery, and within minutes, blood flow is cut off, resulting in a heart attack or stroke. Factors that typically bring on a heart attack in a person already at risk, including dehydration, acute emotional stress, strenuous physical activity when not otherwise physically fit, waking during the night or getting up in the morning, and consuming large, high-fat meals. Risk factors for cardiovascular disease. Many of us are free of the risk factors that contribute to rapid development of atherosclerosis. If so, the advice of health experts is to consume a balanced diet, perform regular physical activity, have a complete fasting lipoprotein analysis performed at age 20 or beyond, and re-evaluate risk factors every 5 years. For most people, however, the most likely risk factors are total blood cholesterol over 200 milligrams per 100 milliliters of blood, smoking, hypertension, and diabetes. Risk is especially high when total cholesterol is at or over 240 milligrams per deciliter and LDL cholesterol readings are over 130 to 160 milligrams per deciliter. Smoking is the main cause of about 20% of cardiovascular disease death and generally negates the female advantage of later occurrence of the disease. The combination of smoking and oral contraceptive use increases the risk of cardiovascular disease in women even more. Smoking greatly increases the expression of a person's genetically linked risk for cardiovascular disease, even if one's blood lipids are low. Smoking also makes blood more likely to clot. Even secondhand smoke has been implicated as a risk factor. Systolic blood pressure over 139 and diastolic blood pressure over 89 indicate hypertension. Healthy blood pressure values are less than 120 and 80 respectively. Diabetes virtually guarantees development of cardiovascular disease and so puts a person with diabetes in a high-risk group. Insulin increases cholesterol synthesis in the liver, in turn increasing LDL in the bloodstream. This disease negates any female advantage. Together, the previous 4 risk factors explain most cases of cardiovascular disease. Other risk factors consider HDL cholesterol under 40 milligrams per deciliter, especially when the ratio of total cholesterol to HDL cholesterol is greater than 4 to 1. Women often have high values for HDL cholesterol. Therefore, it is important for this to be measured in women to establish cardiovascular disease risk. A value of 60 mg per deciliter or more is especially protective. Exercising for at least 45 minutes 4 times a week can increase HDL by about 5 milligrams per deciliter. Losing excess weight and avoiding smoking and overeating also help maintain or raise HDL, as does moderate alcohol consumption. Men over 45 years and women over 55 years tends to have higher risk of cardiovascular disease. Family history of cardiovascular disease, especially before age 50, and blood triglycerides 200 mg per deciliter or greater in the fasting state increases the risk of having cardiovascular disease. Typical weight gain seen in adults is a chief contributor to the increase in LDL seen with aging. Obesity also typically leads to insulin resistance, creating diabetes-like state, and ultimately the disease itself. It also increases overall inflammation throughout the body. Exercise conditions the arteries to adapt to physical stress. Regular exercise also improves insulin action in the body. The corresponding reduction in insulin output leads to a reduction in lipoprotein synthesis in the liver. Both regular aerobic exercise and resistant exercise are recommended. A person with existing cardiovascular disease should seek physician approval before starting such a program, as should older adults. So here are some dietary strategies to lower LDL. Reduce dietary saturated fat and cholesterol. Increase mono and polyunsaturated fats in diet. Increase dietary fiber, especially soluble fiber, and use products with plant steroids and stanoids. Plant steroids have been clinically shown to reduce LDL cholesterol, and products that contain these natural cholesterol reducers are backed by the following FDA-approved health claim. Foods containing at least 0.4 grams per serving of plant steroids eaten twice a day with meal for a daily total intake of at least 0.8 grams as part of a diet low in saturated fat and cholesterol may reduce the risk of heart disease. Products such as margarines and orange juice contain these plant steroids. The plant stanoids or steroids, also called phytosteroids, work by reducing cholesterol absorption in the small intestine and lowering its return to the liver. The liver responds by taking up more cholesterol from the blood so it can continue to make bile acids. The studies done on the cholesterol-lowering effect of these plant compounds have found that 2 to 5 grams of plant stanoids or steroids per day reduces total blood cholesterol by 8% to 10% and LDL cholesterol by 9% to 14%. In people who have borderline high total cholesterol, these plant compounds can be helpful in avoiding future drug therapy. These compounds have been made available in pill form as well. Remember that plant steroids are naturally present in nuts in high concentrations. Wheat germ, sesame seeds, pistachios, and sunflower seeds are some of the richest sources. Surgical treatment for cardiovascular disease. The two most common surgical treatments for coronary artery blockage are percutaneous transluminal coronary angioplasty, or PTCA, and coronary artery bypass graft, or CABG. PTCA involves the insertion of a balloon catheter into an artery. Once it is advanced to the area of the lesion, the balloon is expanded to crush the lesion. This method works best when only one vessel is blocked, and it may be held open with metal mesh called a stent. CABG involves the removal and use of saphenous vein, or use of mammary artery. The relocated vein is sewn to the main heart vessel and then used to bypass the blocked artery. The procedure can be performed on one or more blockages.